This is Dr. Stewart from Timonium Foot and Ankle Center, and we're going to talk about the Achilles tendon. The Achilles tendon is the largest tendon in our body, and the Achilles tendon is actually made up of three muscles in the back of our calf. So our calf muscles, which we have large muscles in the back of our calf, there are three of them. Two of them have the same name. One is the medial gastrocnemius muscle, the other is the lateral gastrocnemius muscle. And then there's a third muscle deep to that muscle called the soleus muscle. And those muscles come down and they turn into a tendon called your Achilles tendon. And your Achilles tendon is a large tendon that inserts onto the back of your heel. So I'm going to show our little foot model here. And this rubber band here represents our Achilles tendon. And our Achilles tendon starts in the back of our, behind our ankle in the lower part of our leg. And it comes down and it inserts. Inserts mean it ends, it terminates into our heel bone. Now, a common condition that we see is called Achilles tendonitis. And to be very specific, it's actually called Achilles tendinosis. Tendonitis is a term usually reserved for tendons that have a tendon sheath, and the Achilles tendon doesn't have a true tendon sheath. So technically it's called Achilles tendinosis, but we will still refer to it as Achilles tendonitis just for ease of conversation. So Achilles tendonitis is a common condition, and people hear about ruptured Achilles tendons all the time, and that is something that happens. Achilles tendon generally ruptured during an acute event. It generally happens here in the mid portion. Typical story is I was playing basketball, I jumped up and I felt my Achilles tendon pop. As a matter of fact, this week I actually saw a patient, that exact story, and I've repaired his Achilles tendon a few months ago and he's doing great and getting back to activity and doing well in his rehab. But today I really want to focus on Achilles tendonitis. So Achilles tendonitis generally occurs in two different areas of the Achilles tendon. One is at the insertion, which we refer to as insertional Achilles tendonitis, meaning the pain is at the insertion. And in this area, patients generally complain of swelling, burning. Burning is a really hallmark feature of tendonitis here. And this area is commonly associated with bone spurs. Why bone spurs? Because what happens is when the Achilles tendon pulls over time, it yanks, it pulls up and creates bone spurring. The bone spurs can rub on the back of the shoe. The tendon can become very thick there, and the pain is exacerbated by shoe gear at times. The other type of Achilles tendonitis we tend to see is what we call mid-substance tendonitis, which means it's coming up a little higher. This is where people, again, tend to rupture their tendon. So I guess, it's fair to say that people that have mid-substance Achilles tendonitis are a little more predisposed to rupturing their Achilles tendon, but you don't just tend to see Achilles tendons rupture just because there's tendonitis. It can happen, but it's not very common. And this tendonitis, there's a lot of swelling around it, and you will see thickening if you palpate the tendon. So everybody can feel their Achilles tendon. Their Achilles tendon, if you put your finger on the back of your heel, I'm doing that right now, and run your finger a few centimeters up, you can feel this big structure. It feels like a big band in the back of your ankle. And if you push your foot up and down, and when you're pushing your foot down, you should feel your calf muscle pull up, the Achilles tendon is functioning. So the Achilles tendon is responsible for pushing your foot down. That's called plantar flexion. And plantar flexion is what the Achilles is responsible for doing. One of the more common complaints is people will develop Achilles tendonitis who drive a lot. It's not uncommon to see this in truck drivers or delivery people or people that commute long distances. They'll complain that the back of their heel hurts, and it's overuse. So, what are the symptoms of Achilles tendonitis? It can be swelling, like I said, pain, aching pain, throbbing pain, sharp pain, but burning is a very common feature. Difficulty walking, joint stiffness, pain first thing in the morning because you're stiff and it takes some time for the Achilles tendon to stretch out, pain when you get up from a seated position. So when patients come in and they're concerned with symptoms of Achilles tendonitis, we'll do an x-ray. We'll take an x-ray, particularly focusing on the heel bone back here to see if there's any spurring that may cause problems. and will, if needed, use an ultrasound to look at the Achilles tendon. We're going to look for inflammation, tearing, and most of the time we'll only get an MRI if we're doing surgery. I mean, I think it's important to note that getting these advanced studies such as MRIs, they can be useful in the right setting, but just to get an MRI when you have someone with Achilles tendonitis, you can use a simple ultrasound, which is significantly less expensive than an MRI, and an MRI can really be reserved for the proper need and just to make sure before you're doing a surgical approach to rule out anything, and even then it may not necessarily be needed. Then we do a physical exam. We examine the Achilles tendon, find out where the area is causing pain, and then we start a treatment plan. Most patients that have Achilles tendonitis in the mid-substance of the Achilles tendon tend to get better, and patients with insertional Achilles tendonitis, a lot of those patients get better as well, but it really depends on how significant the thickness of the tendon is and any associated bone spurring is, which will determine the course of care. We always start off with conservative treatment when it comes to any of these conditions, and we will immobilize the patient, rest the patient, eliminate the activities that they're doing, particularly walking up and down hills, running. You have to really change your activity levels, shoe gear modification, icing, if needed, anti-inflammatory medications. We use therapeutic lasers. Lasers can be very beneficial in treating Achilles tendonitis as an adjunctive therapy. We do not inject the Achilles tendon. Injecting the Achilles tendon places the tendon at risk for rupture, and this is a situation where I strongly believe that the risk of injecting far outweighs the benefit of injection. The general time frame for a conservative recovery can be as minimum as 4 to 6 weeks, and sometimes it can take 12 weeks. And again, it really hinges on patient compliance. I had a patient this week that I've been treating for Achilles tendonitis, just got her out of her boot, and her pain is probably 85 to 90% better than when she started. She literally was limping in the office. So we immobilized this patient in a boot for an extended period of time. We also had her use a splint at night to stretch her foot, and you really can see excellent results with conservative care. In the event that conservative care fails, surgical care is something we'll do. And again, this generally tends to be the patients where the Achilles tendon is very thick on the back of the heel, and it just makes wearing shoes highly uncomfortable. The Achilles tendon is thick, the bone is thick, and what we'll do via a surgical approach is we'll take the patient into the operating room, and we'll open up that Achilles tendon, and we'll open up down to the bone. We'll reduce the bone, and we'll take these large bone spurs off, and we'll debride, which means remove any of the bone and any of the diseased tendon. And then we'll also at the same time release any tightness in the calf. As I told you earlier, that the calf is where the Achilles tendon originates, and frequently there's tightness in the calf that causes this excessive pulling. When the Achilles tendon pulls, it's being pulled upwards, and it's being pulled upwards from, there we go, we just ruptured our Achilles tendon. It gets pulled upwards from the calf. So if the calf muscles above are pulling, this will actually cause spurring on the bone, and we need to release that calf tightness to reduce the chance of additional spurring in the future. If you reduce the bone spur and the prominent Achilles tendon, but you leave the calf tightness behind, technically there's always a chance of there being some recurrence of the symptoms. Patients that have this Achilles tendon surgery generally get back to full activity. I have a patient I treated a few months ago. I can share that he had chronic Achilles tendon pain. We took him into a surgical repair, and after a long, prolonged recovery, because it does take a while to recover from these surgeries, it can take a minimum of 6 months and up to a year for any Achilles tendon surgery. This patient went back to running a marathon. So we have a lot of great options, always starting with conservative. With the exception of an acute rupture. Generally, we will take acute ruptures into the operating room because we tend to find that is the best form of treating these injuries. But unless it's an acute rupture, conservative care is always focused upon first. And if conservative care fails, we do have the option for surgical repair. So if you have any signs or symptoms of Achilles tendonitis, tendinosis, bone spurs in the back of the heel, feel free to click on our form below, request a consultation, or simply call the office and we'll be happy to help you out.